actually here with my mom. She's at her doctor's appointment for rheumatology. And let me just say this about when we first came in. So we first came in, for some reason, this lady, like, she kind of gave she was a Caucasian lady, she gave up. So we all looking at each other like, did you see that? Because I seen it. Like, what the fuck was that? Like, you ain't never seen black people before? What's wrong with you? But anywho, I'm about to basically do a walkthrough through the building because they have such beautiful artwork that the guy said that Houston artists painted. I'm like, oh my God, inspiration. So I'm about to do a walkthrough. I'm about to show you guys what it looks like. It's so freaking pretty. I can't wait to show you. So, come with me. We're about to travel real quick. We got here early. Her appointment is not till 1:30. And we got here at like 11. So we got plenty of time to, well, she's still sitting upstairs. But I'm about to go downstairs where the paintings was to go, look at them. So, let's go look and see what we find.
Driving.
Right.
There's a lot of pressure in my left hip.
See how we still waiting. It's 1:12 right now. 1:13. Just gave mom a little back massage.
Yeah.
So the doctor should be in any minute.
Side I've been talking about that be hurting. This left side right here. It starts here. It radiates up to my left shoulder. And then there's a pain that's set in deep inset into my left hip joint. Just pop my spine. Here comes the itching again. Because you're fired?
Yeah, it was like seriously. Let's go for I can visit the camera.
Okay, that's a real now.
I see a white lady with some glasses on. She look like a very coat.
Does she look young?
Yeah, she's probably 29, 30.
I thought I heard Asian lady.
But it might be over here. Because I'm right here, that two difference come down.
Mm.
Hello, hello.
Hi.
How are y'all?
Not good. Well, she's good. I'm not.
Sorry.
She's good. I'm not.
No worries, no worries. Okay, let me get out of this then.
Just keep trying to shift off this left hip bone.
Yeah.
Sticking out. I wrote like your laugh down so I wouldn't have to keep
Okay, yeah.
coming back and forth
Yeah.
from your thing, but then I didn't bring that with me. So let me go grab that real quick.
Okay, okay.
Be right back.
No, not her.
Well, that's a lady that's come from that side.
No, that lady, that's not her.
Oh,
That lady didn't have glasses on.
oh, okay. This same lady that was saying, come on.
Okay, well, the one that I seen, she didn't have glasses on. And she didn't have no, like, comfortable sweater on, looking like the one there. Totally different person. Oh, gosh.
This is where you
Hmm.
they come.
No, you can stay over here. I have to do that because it goes numb. That's what started making me get like nervous and agitated and irritated because it's numb and dead. And that means how am I going to walk? I think the anxiety be making my mouth dry too. This coloration is just so scary.
And you put it on the small sticky note, and then I couldn't find my sticky note.
That's pretty small.
What can you do? I asked for a sticky note, and this is what they handed me. All right, so let's see. I'm Kelsi. Nice to meet y'all. I'm one of the PAs.
Okay.
Okay, so let's see. So when did kind of everything begin? Let's start there.
It's supposed to start with your complex surgery.
No, like which part? I have several different things.
So what kind of brought you to get the labs done? Let's say.
Okay. I'm gonna say for like the last, it's 2023 now, 2022 to 2021, I had started suffering with a lot of nerve numbness, freezing, the temperature do change in my legs. But I'm gonna say it like this, in 2019,
Was it just numbness or numbness tingling?
the numbness is what's overwhelming, and the tingling only happens when I really feel the nerve comes back. But I don't get the tingles no more. It's just
Okay.
strictly.
So it started
numb.
more numbness tingling, and now it's just numbness.
Yeah,
And is it whole leg and feet, just the feet and toes?
from hip all the way down to the whole leg on this left side.
Okay, what about the right side?
The right side is the knee, lower leg. 2019,
Yeah.
December. I remember it started on this left side, this left hip, what is this called, flank, under my rib cage.
What happened in December?
This was swollen, super swollen, red, inflamed, and the pain would shoot all the way to my left, right within my left hip. And that's when I went to the doctor about that, and then she started taking x-rays and said that I had the S1L5 low lumbar root disorder.
That's a mouthful. Okay, so left kind of low back.
The pain started on my left side, but when she did the x-rays, it's a low lumbar nerve root disorder. That's what she wrote on the paper. I mean, confusion. I meant this started 2019. That's what started, and then at this
things progressed more 2021. Okay, so it was diagnosed with left. Say it again.
No.
Nerve root.
Low lumbar.
Low lumbar. There we go.
Nerve root disorder. L5S1. And then some word called radiculum. How do you say that? Radiculum.
With radiculum.
That word.
So did they ever send you to a neurosurgeon or anyone? Never?
This is all through Harris Health System.
Oh, that's why. Okay.
Oh, so
That makes sense. More sense. Okay, so this was when you were with Harris Health. Okay.
it's crazy that you said that makes sense. Wow. So it was noted. It was known about since December of 2019 about the whole spine thing. And I started falling and everything else, and did another X-ray. It was worse. So I've done 3 X-rays.
Never an MRI? No. Okay. So pain worsened, obviously, over the years, and then got even more bad in 2021?
Yes, like during the pandemic and everything, when everybody had to be quarantined in their house, I realized like by me not being able to get out and move around, my body would just freeze. And I would scream and holler and ask my daughter to help me because I'm in the bed and I cannot get up.
Okay. Now, when back in 2019, was the right side hurting at all?
No, just left.
So when did right side come into play?
The right side probably came into play, like I said, as it progressed. Like I'm gonna say within the last year.
Yeah,
so now it's making me literally have to use a cane all the time. I have a walker. All these things that I borrowed from my ex-husband. So weird.
Okay. So when you were at Harris Health, what did they do
So
in 2019?
2019, she
Yeah.
did an X-ray based on me complaining about this. She goes, "You have neuropathy," and I'm thinking that just means nerve pain. Like, let's get to the root of it, literally. And then so she did an X-ray, told me through the X-rays that she told me X-rays look fine, you're good. You just have neuropathy, and she prescribed me gabapentin.
Okay.
Never took it because I was like, no, something else is going on. Can I get an MRI?
Okay.
After, researching it about, the side effects of it and everything. I wanted to mess with my brain no more than it's going to. So yeah, that's what happened in 2019. Kept complaining about it. She did another X-ray.
Okay. So it was just basically nothing was done.
Basically.
Okay.
Just kept getting x-rays and not seeing anything.
This one doctor, there's several doctors.
No, that's
she
exactly what I'm
knows it's
saying,
Harris Health.
yeah.
There's one
Then
doctor
one
did that,
doctor,
and she's
yeah.
actually the administrator of the clinic. So, yeah. And from there, I stopped going to the Northwest Clinic, switched over to the Acres Home Clinic. This is recent, 2022.
October.
Dr. Amina Shazia, she sees everything on a teledoc appointment, and she goes, "Oh my gosh, I think you have autoimmune stuff." She orders a slew of tests. Shoulder's comes back positive, RA, all kinds of stuff. And when I went for my consultation, I sat there and waited for everybody and their mama to be seen, and I was never seen by this lady. So this is what I'm dealing with, and having my daughter just do any kind of massage therapy and everything on me. So no, I still have not been diagnosed, but I have blood work that shows this lady is very sick.
Gotcha. Now, is most of the pain the low back issues? That's kind of like the root of everything right now?
It feels like it started there, because once my back started doing that, that's when I was like, oh my God, my
Everything
legs,
else
I
hurts
can't
because
feel
you
my
can't
legs.
function. Okay.
That's what made me go backtrack, and I ordered my x-rays, and I started ordering all my stuff and getting all my stuff in.
Okay.
And that's when I can't read it, it's not very clear, so that's why I was complaining.
Yeah, it showed like mild arthritis, but you need an MRI if it's more nerve-esque.
Right.
Okay. Now, what other, like, do your hands hurt at all?
Yes, like holding on to my cane, it'll start to, you see that? It'll start to throb really bad.
Okay.
And so that's why I'm just normally in bed all the time, trying not to even write. There's times when I'll just start, just from trying to write or hold the cane, I'll do like that. So yeah, my hands, I can't wear rings, the discoloration, turning blue, just from holding the cane. So yeah, and it's all in my legs. I've never had this discoloration in my legs.
Any recent falls?
I fell, when did we move in? Last year, May?
June 2022.
Yeah, I fell. And sliced up my right thigh. So I fell onto a shelf.
Okay.
Legs went out. It's like my brain was like, oh God, you're gonna fall. Try to sit on this shelf, and of course I shouldn't have sat there.
Yeah.
It was
No
not
broken bones though?
No, just
Okay.
sliced up my leg, superficial cut. Sliced up my thigh. And these stitches, thank God. Everything else when I fall is just me trying to go to the bathroom. You know, the left leg gives out and then I fall. But my daughter's always with me. So, you know, I grab onto her and then she helps me use the bathroom, stand up. It gets bad.
Yeah.
But here's the weird thing. My back is not hurting when that happens. So it's confusing me. It's like, when my back hurts, I don't do anything. I can't do anything. But there's times when I'm like, I gotta use the bathroom. She's like, you need me? I'm like, I think I'm okay. And then I'll feel it. And I'm like, oh my God, I can't get off the toilet.
And she constantly complains about like something's pulling her in her back.
Yeah,
She's
it feels like that right now. It's weird. It's like, and sometimes when I'm stressed, I can feel like it's a pull, and it feels like a hook is in that part of the back and pulling down.
Okay.
And so I cannot do anything. I'm just laid up like this. That's what started happening when I was describing. I would be in the bed and something would happen where my legs would go dead, both of them. And I cannot move. And it'll come up to my extremities.
Is everything like numbness tingling, or now just numbness?
So when I say the tingling part, my nerves are so damaged, I feel, because I can never feel the tingling no more. That's how I don't know that they're coming back alive.
Numbness.
It's the extreme numbness.
Now with so outside low back, obviously biggest issue, left side, all that. Any changes in vision?
Yes. These are not prescribed, by the way.
Okay.
But yes, I a lot of flurries in my eyes. Like a lot of,
like floaters?
yes.
Okay.
And I'm constantly, what's in my eye? What's in my eye?
When did that start?
I'm gonna say that's been about a year now. Maybe longer. Like I said, these conditions, until they start getting to where I couldn't see, I can't write. Then I'm like, oh my God, something's going on in my eyes. But
Do you
before I
have
was thinking this
complete loss of vision or just floaters?
No, just flutters, and it just seems like my eyelashes are always in my eye. I'm constantly messing with my eyes, and then they were getting red, bloodshot red for a long time. That's why I'm trying to tell you, like over the years, they've been getting bloodshot red. And I'm taking Benadryl, and I'm like,
it would be the random branch across her cheeks and
Yeah.
stuff like that too. Kind of like a lupus rash.
Now, any recent eye exams?
no.
Okay. Any dryness of the eyes?
Yes. Extreme. I use eye drops.
What eye drops do you use?
Just amazing. What's the name of that company? Similistan?
Okay.
They have an eardrop and an eye. I have both of those, and I do get frequent ear aches.
Do the eye drops help at all?
The kind that I got, the stimulants, not the Visine, do.
Okay.
They just kind of clear away the flowery film feeling on my eye.
Okay. Any dry mouth?
Yes, right now. I was so grateful that he gave me water. Dry mouth and a lot of mucus in the throat. It's like a hacking and then coughing and oh God. One thing I can say, the blood test that she did do that came back super positive was the Sjogren's.
Yeah. It was, one of them was a little positive. Everything else actually came back looking pretty decent. But
I was concerned about that hepatitis thing too. I saw something in there, and that's what really expected me with this doctor when I contacted her and asked, like, what does that mean? Because I haven't had my liver analysis done in quite some time. But I was diagnosed with non-alcoholic fatty liver disease back in 2013. That's why I said this isn't a culmination of bad breakdown of my body, because I was diagnosed with inflammatory bowel syndrome, ulcerative colitis, all of that in 2014.
Yeah.
do you have a new primary care?
No. She put herself as my primary care, the lady that didn't see me, and ordered all that blood work. But I've been arguing with Harris Health ever since about that, because I was like, why would she be my primary if she didn't even treat me in the correct way in the first place? Like, are you crazy? So no, there's no primary on there, but I did have them add Dr. Voe as they have Harris Health and then they have Dr. Voe, because they're like, well, she can't be a primary because she's a specialist, or she doesn't want to be a primary. I was like, okay. So no, I don't have a PCP yet.
So it was showing that you have antibodies against hepatitis B.
Yeah, that's what I was.
So that's probably, you had a vaccine as a child for hepatitis B, and so it's showing that you have antibodies against hepatitis B.
Okay, against. Okay,
Yeah.
Thank you for that clarification.
Yeah, everything else is fine. Okay. So we definitely, kind of right off the bat, my initial, because there's a lot going on, so it's kind of, we want to kind of start ticking away.
Yeah.
You know what I mean? We don't want to kind of like try to tackle everything at once, because we're going to get overwhelmed. So if we try to tackle back first, and maybe have you see an eye doctor, get an eye exam, see is the floaters due to something, or is it because you get floaters because of maybe the dryness, something, you know what I mean?
Well, I'm gonna have to say this,
eye
I was in a house that had mold, so a lot of the stuff that I could have been going through with my immune system have been triggered by that.
So Houston Eye Associates are good, I don't see any place, but we want you to see an ophthalmologist, a medical eye doctor, so they can really look at the back of the eye. That's key, because anything when it comes to eyes, we can't see. They look at eyes all day long, so it's going to come from them. Okay?
Right.
So do that. The eye drops you're using are fine right now, and kind of depending on how much they continue to help versus not, then kind of decide more things. And then once you get an eye exam, they may want to do prescription eye drops.
Right. I see what you're saying.
With your dry mouth, does just drinking water help, or do you use any lozenges?
Like right now I have some sugar-free mint gum.
Okay.
Really, it's the Benadryl. The Benadryl does it, but the Benadryl kind of helps with all and I'm itching all the time. So I'm like, I try not to take it because it makes my mouth even dry. But when the itching it's like itching, and I had to take it. So it's really the Benadryl. Yeah. But normally I'll just, try to do some cranberry juice, some tart to try to make me salivate.
Okay, so when did the Benadryl start that you started using it?
I've been using Benadryl for a while now, just because I have nothing else to take. Well, she gave me 500 milligrams of naproxen, but I take that with ibuprofen, and it just helps stop the itching of the eyes. So I've been doing it for a while.
Yeah.
Like, that's it.
Have you ever had allergy testing?
Mm-mm.
Any problems ever with allergies before?
Yeah, I mean, I was diagnosed with sinusitis, but we live in Houston, so, everything, and like I said, we were living in an apartment that we did not know mold was behind the walls. So ever since we moved out of that apartment, my body is still, going through, especially all the research I've done about mold, like
Yeah, it's terrible.
wow. So yeah. I just want to know what's going on with all this fluid retention happening, because I'm so scared that my kidneys might be in distress. This swelling is crazy.
So with the itchiness, is it just like generalized itchiness of the skin?
Yeah, it's like ticks, like, oh, my back is itching, oh, my arm is itching, like, oh, I'm itching all the time. And I'm just gonna say this, my ex-husband, he had renal failure and he itched all the time. And he was swollen and hard and swollen. It scared me. It scared me so bad. And also my spine pops a lot. It's like a zipper.
Okay. Do you take Benadryl every day?
No, I can't. Like right now, I took it last night so that I could sleep because I was itching so bad. I was scratching myself up, and I took it, and now my throat is like a desert. So I don't like to take it. It's horrible.
We may want to redo allergy testing as well.
I've never had it done.
Oh yeah, you told me that.
Yeah.
Start and do allergy
Yeah.
testing. Okay.
Yeah, that makes sense because by me being diagnosed with the IBS stuff, it could have been like a food allergen or something.
Yeah, there can be a lot of different kind of allergens, and then you were exposed to mold.
Yeah.
And mold is terrible. Let me go back and look. So blood counts, you're a little bit anemic, but like 0.2, so that's not worrisome.
Oh, really?
Yeah.
Okay.
So not worrisome there. Let's see.
Is anemia would be the culprit in the temperature change of my body being so cold?
Probably not,
Um,
but it's hard to know 100%.
Okay.
You did have some protein in your urine, but then they did the protein creatinine ratio, and that was normal.
Exactly why I'm concerned about my kidneys.
So then we might have you see nephro, but let me look at what your other.
Yes, please. I'm telling you. The reason that you're saying, the fact that you're saying about they did the creatinine, I had got the virus, the flu, basically, in December 2021, and I was rushed to the hospital for 104 temperature, and I did a urinalysis, and that same protein was there then,
Gotcha.
2021.
Let's see what your kidney numbers actually look pretty good. But why are you having so much protein in your urine? Yeah, you actually have pretty decent kidney numbers. Okay. Okay, so definitely, eye doctor, ophthalmologist, definitely MRI.
Right.
Like, we're not gonna sit here and do x-rays all day long. MRI.
Okay.
MRI, lumbar, sacral. Bam.
Sacral.
MRI.
Could that nerve be the one that's in that left hip that's doing all that?
Potentially, we can, if we want to do MRI low back and then another MRI left hip, we can, or we can start with MRI low back. Just, I don't know, insurance-wise. You know what I
Okay,
mean?
yeah.
And then I can give you orders for both. If we
Okay.
want. Okay. But if it feels like most of it comes from the back, then definitely back. You know what I mean?
Okay.
And then it could just be favoring that side.
Oh, I see what
Okay.
you're saying. Mhm.
Do you ever have groin pain?
No.
Okay.
It's
So
It's
usually
just-
with like true hip pain, you feel it more in the groin.
Okay.
Like if it's of the hip joint. If it's
Oh.
more kind of feeling like it's back here, it's
yes.
probably all lower back.
Yes.
So I think starting with a lumbar MRI
That makes sense.
is probably
Yeah.
enough, and then we can always do another MRI.
Right, makes
You know what I
sense.
mean?
And
But
what would the MRI actually show?
so it would show. So X-rays only show bone.
Mm-hmm.
That's it. MRI shows soft tissue as well.
Oh.
So kind of muscles, tendons, all
I
that.
see.
A picture of looking
Okay.
for issues like nerve gas, because if there are, then you know to go to a neurosurgeon or someone that can fix that.
Mm-hmm.
You know what I mean? So you don't know what's going on or what's causing the nerve issues if you don't evaluate for the nerve issues.
Exactly. That's
Okay.
exactly what I said. Yeah.
So I think MRI. I don't think there's any other labs we need right now
Mm-hmm.
that I can think of off the top of my head, unless, especially if we're gonna try to. Here, it's interesting that you have so much protein in your urine, but all your other labs are normal. So let me talk with Dr. Voe. She's gonna come in too
Okay.
about that and see if we want to do any extra labs right now,
Yeah.
and then potentially go see an allergist to kind of rule out. Okay, do you have just bad allergies? Is it something from the mold?
Right.
When did all the overall itching start? Around that time?
Afterward, like we just found out about the mold in 2021. Yeah.
Yeah.
And so a lot of itching started after the fact.
Okay, when did you move out of the place?
May.
No, it was May 31st, 2022.
Yeah.
So you were in that place for a long time?
Yes.
Oh,
From 2012 to.
Yeah, we didn't know. It's in the air conditioning.
Yeah.
oh, yeah, that's a lot.
Yeah.
Okay. So mold.
Yeah, it's in the air conditioning, and we didn't notice until it was on the vents.
Yeah.
Oh,
And I was exposed to it for a long time, dizzy, falling out, all kind of stuff. Yes. That's why I said, let me bring that up to her. I've sent it to other doctors and they just disregarded it.
So when she had a gallbladder removed in 2014, I believe that was June of 2014, because the
I think
mold
it was
is,
2015.
I think it was 2014, because you had already had it before I graduated,
Oh yeah, you're right.
you know?
but you discovered the mold in 2021.
No, she said she's about to say 2016.
When she had her gallbladder surgery in 2014, June of 2014, 2015 I graduated.
Just trying
About
to remember
2017 is when it started exposing
Yes,
itself
2017.
outside of the,
For me, it's okay like this. You live in an apartment, it's clean, okay. And I'm like, what is this on my vents?
right. But I'm saying, because since she had her gallbladder surgery, the symptoms that she started progressing to
Oh,
have,
yes,
you know,
that's why
could
she
have
said
been a
that
cause of the
Because
mold
I
as
thought
well,
that I'm
you know?
vomiting.
Yeah.
Because it could have.
I thought I'm vomiting and everything because of course I changed my diet and stuff, but I thought I was, vomiting and dizzy and stuff because something didn't go right with the surgery
Right,
or
that's what I was
something.
trying to say.
Gotcha.
And I was thinking, because my ER doctor did tell me that I had a gallstone inside of the common bile duct. So I would need the
Yeah.
ERCP done, and I never got that done. So I was thinking it was that. But then when I started seeing the mold,
Yeah.
I still didn't test for it until recently because something I just guided, like tested. It's their apartment, and I tested it, and it had all kinds of different variations growing literally behind the walls. But it came out to us on the vents.
Yeah.
So yeah, I was exposed to it for a long time just because I didn't know.
Gotcha. Okay.
So that protein, that's why, like you said, the protein in the urine, like what could cause that?
Usually it's kidney problems.
And it's
See.
weird that the kidney test is showing that. it's-
Yeah, and so
Yeah.
we might need just to go jump the gun and go to nephro.
Oh,
Any pain right now when I touch the individual joint, or is it more like just
ah.
generalized pain?
That's where it hurts at.
You like the muscles?
Oh, yes. Oh. Ah! Oh. Ow. I'm so swollen, like everything hurts. I'm gonna holler. I know you feel it, like the tightness. Oh, God.
Have they ever given you muscle relaxers or anything?
Yeah, but I won't take that because I'm just so nervous of being dizzy and thrown up from the vertigo, and I'm not gonna
She's
take
very
it.
sensitive to medicine, so,
Okay.
just try to give her,
No, because
kind of a muscle
the
relaxation.
dizziness and falling out and stuff like that stuff, I have a weak system.
That's basically what I'm saying, so muscle relaxer might make it more.
How long did you have vertigo?
Oh my God, that just scared the hell out of me. I was on my left side, and sometimes the pain is so bad, I have to lay on it and stretch.
Mm-hmm.
And sometimes I do that and my back will go pow, and then the pressure's relieved, and I'm like, this time it didn't do that, but instead it gave me like this sharp pain in the back of my skull. And I go, oh God, Ashley.
Yeah.
And she comes and she's like, Mom, what's wrong? I said, and the room said, what?
Yeah, her eyes was like going back.
Oh my God. And I just threw up, like, oh my God. It just, that's happened at least, what, 2-3 times already? Within the last 2 months, within the last month.
Yeah.
It's so scary, like, oh my God. Every time I think about that, I felt like I was in another dimension.
So if we see an allergist and an ENT, they can help us with the vertigo as well. Allergist, ENT, kind of all the same thing.
Right.
Okay, let me go start putting stuff in,
Okay.
and then let Dr. Voe kind of know what's going on, and then she'll come in as well. Okay, just hold tight a little bit. I won't poke and prod you anymore.
No, it wasn't you. It was just remembering how that felt.
Yeah. It's okay. We got it. We got it, okay? Let me start getting everything in there, okay?
Yeah.
Okay? We got you, okay? Hold tight for me, okay?
That was so scary. God. I'll never forget what that felt like. That was so scary. That was so scary. It was just like it was when we were in that other apartment, and I was starting to feel the numbness coming up my whole body.
Right.
It felt that way, but it was like, it was just that left side, so I was, let me lay on it and stretch.
Right.
You remember that happened? And
Yeah.
I turned and you massaged me right there. Oh my God, that was so scary. I'm glad she seen the protein in my urine. I remember how tiered stuff was just like, these numbers was off the charts. And I'm like, how could you not have thought it was your kidneys? Like, I just remember what he went through, but what I'm saying is I remember what he went through, but I remember that swelling and that hardness of his body. And I couldn't understand how he felt no pain. But I guess because the diabetes kills off the nerves and stuff, but it was crazy because it's like he had no pain. He would just tell the doctor, you see how she squeezed me? That hurt. He'd be like, no, I don't feel nothing. I don't feel nothing. Because whatever the autoimmune thing is, it is attacking my kidneys. That was so fucking scary. She has to understand the way you're trying to remember the timeline because it is so much. You're trying to remember the timeline because when they always say when and how long, I have to turn to you because it's a blur to me. All I know is I've been sick a long time.
Exactly. That's why I had to bring that up about your gallbladder surgery because, yeah, you know what I'm saying, your body was already kind of decompressed to a certain degree because you know what I'm saying, your body was just open and cut, so you trying to build your immune system back up to be stronger, and the mold is coming out that damn vent. How hot does Houston was summertime? That was during summertime, so you know we run back.
You have to wear that tissue pretty much all the time.
Yeah.
Shit,
We were just freezing, we were getting candles, the next thing you know it's hot.
Yeah, the only reason why they probably won't because it's a, facility like this.
Right.
But when it's freezing, they have to do something. Like, you can't have it, oh, I'm 60 and it's freezing outside.
Right. That just wouldn't make sense to me, right?
I'm just glad she said that I have the antibodies for the whatever she said that,
Yeah, for the hepatitis.
that clarified that for me. But that's why I told her the protein been in my urine since 2021. That it came to my attention. And that's probably why they were calling me. But leave a message saying, why you calling me?
Is it?
Don't ask me to give you a review. And when she seen her, when I said herself, she's like, oh, that's crazy.
Because they know they don't be doing shit. That's exactly right.
And Rose was talking about that. I said something, hopefully it's not my kidneys. Because that could have a lot to do with the swelling. And you see, she said nephrologist. That's a kidney doctor.
But you see that I got a doctor appointment with the same doctor that I got that she told me to ask about, so we can get you set up on one too. The same doctor.
Well, I mean, I'm not worried about that first and foremost. I need the swelling to go away.
Of course.
Go
No, I'm
down
just
and
saying
find
that.
out what it is. I mean, give me a fluid pill so I can pee more or something.
Right.
Because I can't even really pee good. Like I can feel like pushed up to pee, but then I never feel like I'm finishing emptying my bladder all the way. And that stuff right there, man, just thinking about that. And then when I watched that mystery diagnosis and it was happening to that dude and he had just got out the shower and it hit him like, oh my God, he was by himself. They found out he had something going on in his ear.
And how many times you been having that going on to get too? Shit, since that damn
Since I got that virus, my ear started leaking. But that's why I told her about the mold, because the mold can literally set off. Your immune system would go bonkers.
Yeah.
She was like, oh, you were in it for a long? Yes. We
Yeah,
didn't
we
know.
moved in December 2012.
We didn't
That
know.
shit popped up in 2017 and we just moved out in 2022. Yeah, it's been a long time. That has just been building up and building up and building up until it's finally showing its ugly face like shit. I'm tired of hiding shit. Let me come on out.
And then remember they changed out the vents and everything like that. That's so scary. It's like every time I think about it, it's just terrifying, man. Just to think how it felt. And like there's times when like I see why she said for me to get my eyes looked at, but there's times when like this pain is in my hip again. It's like shooting down in the hip. And if I don't stretch or do something, it'll do some weird shit. And make my brain do something. Like you don't play around with the nervous system, baby. Nothing about the body should you play around with. I told you, that's what Shane told me, that Dr. Voe was gonna come in for. Sylvia just didn't know she was talking about pee again. So I'm so glad that she said, but why is there so much protein in here? Exactly. This is what I was talking to Dr. Lunge about. Oh no, that's fine, that's fine. What? Then I bring it up to Dr. Amina. Then she actually tests me again.
That's the thing that be killing me about certain doctors. It's like when we sit here and get certain test results, they'll literally call you on the phone. They'll verify that you are who you are, and then they'll give you the information. But if they still want to make sure that they see you, they're like, okay, well, this is what we found, but we definitely still want you to come in and, remember this.
She ordered me an MRI.
Exactly.
I've been asking for an MRI since 2019.
And they know motherfucking X-rays ain't gonna show that much. Like, it is gonna just show the bones. Like, why would you think an X-ray? I didn't say
Even the print, even the way they did it, it ain't showing a definitive. It's like my bones are like see-through or something.
Right.
Like, where's it at? I don't see it.
Exactly.
Like, what are you telling him to use the lowest resin or whatever, however it goes? Like, use the lowest one. Like, I don't trust nothing about them. I just took a couple of sips of water.
Yeah.
So, you know, as soon as I take a couple, plus I'm cold, take a couple of sips and I have to go pee again. This is crazy, man. That scared the hell out of me. Just thinking, like I can think about when I had my tonsils out. I don't be like, oh my God, it was horrible. I can think about the type of things that went wrong when I was having you. You know, the type of things that shouldn't have happened. You know, I'm not traumatized by it, but that being not cared for and that happening, that was so fucking scary.
Right.
It literally looked like I went to a different dimension. Like the room said, like the whole room just, and when that happens in your brain, you're gonna vomit.
Right.
It's coming next. And I had, you know, ate some dinner, so that was a lot. It literally like it was fluid. It's like, now that I think about it, it's like it switched up to fluid in my body or something.
Yeah.
And I needed to get it out because that was a lot.
Yeah. Substance. And you were eating like fried shrimp. But I guess because when it digests in the stomach.
No, it wasn't that. I'm saying, no, you smelled the bile and it's a throat never gonna smell good. I'm saying it was so much. Like I was it was like fluid is what I was throwing up, is what I'm saying.
Yeah.
It was not food. And then when it happened again, I just ate a little bit because I was scared to eat.
Right.
Anything, and I just ate a little bit. That's probably the shrimp you're talking about. Because, it was those noodles.
Yeah.
I had that
With
soup.
the egg.
I had that soup. So that's why she said that about the allergens, to see what it is that I'm allergic to.
Yeah.
It'd be crazy, like, oh, you have celiac disease. So they were like, okay, you can't have rice, you can't have this, you can't have that. It would make sense because when we had the Chipotle, I'm like, oh my God, my stomach, oh God. That's how I know I'm just a special baby, because I was gonna have all these things. It's just that I went through life in the hood and everything and nothing showed up then. It's crazy how it's gonna happen later in life. I said it would be a good thing to happen early in life, but at least my mom had insurance and hopefully the right doctors. And it could have been detected, so I already known about these things.
Right.
Like, I can't make none of this up. You're not gonna find no doctor saw me. This would be my official visit. Oh God, my back is cold. I'm telling you, it's like, oh, wow, okay, Spirit, thank you. Gratitude for the comfort, gratitude. It's like my body just got super cold, like a cold current went through my body, but it alleviated my pain. See how my light bulb got a little brighter.
Mm-hmm.
But my eyes over here moving like a million times an hour. Just lay it down and just keep doing it. But this is another part of it where I'll get cold.
Mm-hmm. I
think that's the reason why like I don't be feeling it, because I'm cold.
Yeah.
I gotta pee so bad. I just don't want to go. And Dr. Voe was like, no, where she at? Like, she had to pee. was so scary, I swear. I don't give a damn. I really wouldn't wish that on my worst enemy. Like, that was so scary. It wasn't just this swooping, it was the feeling. My brain was like, boom, 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 boom. Like it was vibrating or something that was not normal.
Right.
It's like I wanted to hold my brain. Like, no. Literally like something was lifting my brain up out of my skull. And I'm like, give me I need that. Like, that's what it, oh my God, my body was separated. My body was separated from it. It was, yeah, that lady was not that same. Because the other one, she didn't have like glasses on. That wasn't the same lady.
But
And
I
that
see
sweater.
somebody sitting with a sweater at that table.
Really?
Yeah.
That did not
I
seem,
don't remember seeing
that
that.
don't seem like the lady that walked out, that elderly lady. I think this was right before you came back.
Yeah, it had to be, because I didn't see nobody.
Yeah, you right before you came in the door, because it was a bougie black lady that was in out. That's what I'm talking about.
Mhm.
That the guy that gave me the water,
Yeah.
and you came in right before that. She walked an elderly lady. The elderly lady that was sitting in one of the chairs.
Mhm.
You saw her.
Yeah.
That wasn't her though, because her voice.
Yeah.
She has a very like empathic way of speaking. I just don't like when she was doing her eyes like.
Right.
Okay, like you're telling me too much. Like, you gotta watch your facial expressions. And so no, that wasn't her, cause I would remember her because she had glasses on. She had her hair kind of like in a clip or something, and in that sweater. That woman, the other lady out did not have on a sweater. Now, that might have been her at the table. But I'm like, well, how is that she looked different? I'm sitting right on the sofa, I'm looking at her. She's like, I have time, because she was talking, so I remember her voice. She was talking. She's like, yeah, by the time your appointment, when she be at the hospital location, it's still in construction. Hopefully we'll be in there. So that was a different voice. Oh, I gotta pee. It's gonna keep bothering me, but I don't pee. So I'll leave this right here.
Okay.
Where's my camera?
Right here.
And I'll pee. So that way you ain't gotta bring everything again. I gotta pee. It's gonna help me anyway to walk some. Cause see, when I sit too long, that's when that stuff starts.
The chewing on the gums.
I'll be alright, just gotta go pee real quick.
Okay.
Okay. I told my daughter, I said, watch when I go pray, she's coming. Yeah, I'm fun to know. Yeah,
And then you are Dawn.
Yes, okay.
Okay, I'm Dr. Voe, I'm
Okay.
Dr. Kelsi International. Just, I just want to say hi.
Hi.
Just a real quick blurb. You're here, I know you have SSA antibodies, serologies.
Uh-huh.
Sometimes we can see those in some patients with what we call Sjogren's syndrome.
Right.
Sometimes it doesn't mean anything,
Okay.
okay? So we kind of put the symptoms together and kind of, develop a plan.
Right.
Sjogren's syndrome is a cousin to lupus, okay? But I would say majority of patients are very much milder, okay? But it is a spectrum of disease. So early on, it might be dry eyes, dry mouth, dry anything.
Mm-hmm.
And this group, we just manage supportively. We might say, hey, go get some eye drops or
Right,
try
right.
some saliva substitute. Very simple, whatever. Down at this end of the spectrum, people can have organ damage, they can be very ill, they start acting more like lupus.
Yes.
And then you have a bunch of people in between here, okay?
Right.
Right now, I'm not hearing anything hugely of any major organ changes. It sounds like you have a little dryness. You're gonna see the eye doctor for us, because they can help locally as well.
Right.
Try biotin products, saliva substitutes. You can ask the pharmacist first to see, hey, what do you have that can try? Give those a good try first, and then next time when we see you, and we can adjust, and we can even try something by prescription if we need to.
Right.
All of our connective tissue diseases can affect different organs, and we'll continue to talk about it, evaluate and see.
Right.
And if we need to add on more medicines, we will, but again, we don't have to like right away.
Right.
You know, because our medicines can be toxic.
Yes.
And so we wanna pick and choose when is the right time, okay? The only thing she saw a little off was the kidney. There's some protein in the urine.
And I'm swelling
And
profusely.
so I don't know if that, again, is just you're normal or not, but you should see a kidney doctor, because we usually have them kind of follow along if there's any concern for kidney, because if there's any major problem, you already have a kidney doctor, it's easy to get in.
Exactly.
Okay? Or they might say, I'm not worried at all.
Right.
At least we're reassured.
Okay.
Okay? So kidney doctor you need to see, eye doctor, and then the only thing Kelsi thought maybe it was allergies because of some rash or irritation you have. Pay attention.
What she was saying about the mold, I was exposed to black mold.
Oh, yes,
Toxic
so
mold.
they can help kind of further evaluate that, because that's very difficult to kind of assess, but they will be the best people probably to kind of say, or, okay, it's a concern. Okay? And then,
about the MRI, are we gonna still do that?
yeah, the back pain, if you're having a lot of like continued pain, which sounds like it's pretty moderate to severe,
Yeah.
and sometimes it shoots down, right?
It is.
The MRI's purpose is to obviously rule out anything else going on in there, but also see if there's any nerve impingement where we might have to do something different. So I think she did go ahead and put in the MRI order. Sometimes I will admit to you that the insurance will poo-poo the MRI, deny the MRI until you've tried physical therapy, until you've had injections, until you've tried some form of medication for at least 6 weeks. They've been very strict about that the last few months for us. So, but we'll try. I'm not sure what your insurance is, but we'll write the order. If they come back and say, no, try this first, then we might modify our plan.
Okay. Would there be anything I could take as far as like a fluid, something to release this fluid? Because I'm having so much fluid pressure pain.
Yeah, see the kidney doctor. I don't want to, because some of the fluid medicines can also dry out the kidneys and cause more problems.
You're right.
So that I just want them to assess you first without it. And they will be the perfect people to guide how much and, you know, all that stuff.
Got
So
it. Got it. Makes sense.
Over the counter meds for dry. Meds. Okay. It would be nice if you were able to see some of these doctors before coming back, and that way we have kind of a consensus what's happening.
Okay.
So why don't we tentatively, and then you would try the eye drop. So let's say about 2 months. That'll give you time, because I know there's like a lot of things to do.
Right.
Let's say 2 months follow-up, okay? Unless something else changes.
Okay. So when you said you looked at the blood work from the previous that I sent in for the Sjogren's, you're saying what range am I in on that?
It's actually not even classically hot, super high. It's kind of in the middle. Like, yeah, it's a little more than mild, but it's kind of moderate high. So the number is usually less than 1. Often we see patients with definite Sjogren's have greater than 8 as a number. I think yours was like a 6 or something. Do you see what I mean? You're like up there, but not like amazingly high. So we'll see. You know, like I said, sometimes that number has nothing to do with your problems, you know? And dryness can be from anything, you know, allergy season or medications and stuff. So I would say it's not definitive, but something we will monitor for. But if you do have those high numbers and some dryness, then it's suspicious. Occasionally we might do like salivary gland biopsy, but we don't do that as much really because it doesn't always change what we do. Like I said, whether I think you have Sjogren's now or you have dryness, I would tell you the same thing. Try these over-the-counter things. Do you know what I'm saying? So it doesn't change, and plus the biopsy is still invasive, you know,
Yes.
if it's not getting us more information.
Right,
that
makes
we need.
sense.
Okay, but
Yeah.
at some point down the road, I might say, well, you know what, we need to make a decision, you know, then we
Right.
may, but for now, I don't
Okay.
think we'll add anything at this moment.
Okay, so we're gonna see the nephrologist right away. We'll make an appointment.
Yeah.
I'm concerned about the urine issues.
Yeah,
I mean, I'm
And then-
able to go and release my bladder, but I always feel like I haven't emptied all the way. So I don't know if I have like a bladder infection or I don't know. I don't get the pain, you know, like the UTI pain, but it does feel like my bladder doesn't empty all the way. Like it cuts off,
yeah,
you know, so I feel like I urgently need to go
That'd be-
pee again.
yeah.
And then, yeah.
That might be a urology issue too. It's like, now all of a sudden you're seeing like all this stuff. Start with this first.
Okay,
Okay.
okay.
And then also your primary care will be a good guide to kind of help kind of making sure things get to where they need to.
Okay.
Okay. Good to see you.